Hello there, I'm Kate Miles from Romney Marsh Osteopaths, and I'm here today to talk to you about golfers and tennis elbow. Now, golfers and tennis elbow can lead to regular pain in your forearm, especially when you are active. So how can you tell the difference? They do affect different parts of the arm, and even if you have never played golf or tennis, you could still be affected by either or both conditions. Tennis elbow affects the outer edge of the elbow when your palm is facing forwards, and is generally caused by repetitive motion and irritation of the tendons that attach to the outer elbow, and can be caused by tennis or any other activities that target this muscle group. Symptoms usually develop gradually with mild discomfort, which with continued use worsen over time. Pain may spread down the outer forearm, is often worse for elbow and wrist extension. Sufferers may also have difficulty grasping or lifting, a weak grip, sharp twinges on elbow rotation, wrist pain, tingling into the fingers, and aching at rest. Now, tennis elbow is most common in the 30 to 50 age bracket, but anyone can be affected, especially if they have experienced an elbow injury, are genetically prone to minute tendon tears, or undertake repetitive muscle use, such as those who play racket sports, baseball or football. And those who work as plumbers, butchers, painters, bricklayers, typists or hairdressers, plus crafters who knit, crochet or scrapbook. But whether traumatic or repetitive, if left untreated, tennis elbow tends to progress, and simple activities like turning a door handle, shaking hands or brushing your teeth can become a near impossibility. So seeking medical attention is essential. Now, golfer's elbow is similar, but it affects the inner elbow whilst your palm is facing forwards, and is generally caused by repetitive motion and irritation of the tendons that attach to the inner edge of the elbow. Symptoms usually develop gradually with initial mild discomfort, which worsens over time. Pain, numbness or tingling may spread down the inner forearm, and is often caused by golfing, weight training, gardening, shoveling, throwing a ball and painting. Pain often occurs on making a fist, twisting the forearm, and stiffness into the elbow, plus the area may be tender to touch and swollen. Over time, this can lead to weakness into the forearm, wrist and hand, which may make flexing your wrist, picking up with your palm and squeezing a ball difficult. People aged 40 to 60 are most likely to be affected, especially those who are female, smoke or who are obese. Now, golfer's elbow can also be related to sustaining an elbow injury. Whether traumatic or repetitive, if left untreated, golfer's elbow tends to progress, and simple activities like cooking, using a keyboard or brushing your hair can become very problematic. So seeking medical attention is essential. Both these conditions seem very similar, but to summarise, they are repetitive use or injury related, most commonly affect your dominant arm, depending on body use, and lead to inflammation. But tennis elbow affects the outside edge and makes extending your wrist, spreading your fingers difficult. And golfer's elbow affects the inner edge and makes flexing your wrist and making a fist difficult. So other than resting, what can you do about it? Now, treatment is aimed at reducing inflammation and improving function, so seeing your GP for medication is worthwhile. Joint injections can potentially improve symptoms quickly and can last for 6 months. And if you alter your daily habits plus seek osteopathic and sports therapy treatment, then this may last even longer or resolve your symptoms, especially if you regularly undertake prescribed exercise rehab. Now, treatment can work directly on the elbow and wrist area, but also address other relevant locations such as the upper body, which may be harbouring mechanical issues, leading to an increase in elbow vulnerability. Treatment can be gentle, which is preferable if you're in pain, then can be geared up if and when required to boost mobility. Now, self-help with regards to supports or kinesio tape around the elbow and forearm can help when used regularly. Cold packs to reduce inflammation and pain can also be of great benefit. Plus, the use of a TENS or ultrasound machine at home may also be very helpful. A combined approach is generally best, so manual therapy such as osteopathy or sports therapy, as well as medication, ice packs and rest initially, then exercises to strengthen and stretch 3 times a day for 3 or 4 months, followed by a low-key maintenance exercise approach going forwards. Imaging and joint injections are of course a consideration if severe, and even surgery if symptoms are resistant to all treatment options. Please call Romney Marsh Osteopaths on 01797 361111 to book an appointment or to request more information about your repetitive strain injury or anything else that is paining you. Thank you for watching. I hope you found that useful. Goodbye.